Childhood strokes are obviously a serious business. There can be very small ones, sometimes with almost no sequelae, meaning no negative effects. But even relatively small ones can cause major issues. In childhood, when you have a stroke, you definitely have brain injury and you have loss of brain tissue, which means usually loss of function. Now, the advantage of having it as a child is that children do tend to recover better. They do tend to recover some function better, and sometimes they can actually even appropriate other parts of the brain to take over some of those functions. It's not a guarantee, and each situation is different, but there is more hope for younger patients in general, which is a good thing. Taika's situation, hyperbaric oxygen therapy, really is ideal because the whole problem was a lack of blood flow to a certain part of the brain because of the stroke. So a stroke is a vascular accident in the brain. So in his case, it was a bleed. He had an aneurysm which apparently bled, and it damaged some of the blood flow to certain parts of the brain, and those cells didn't get enough oxygen or blood flow. Putting him into the oxygen chamber, the hyperbaric oxygen chamber, we were able to get oxygen to some of those cells that otherwise can't get oxygen. Now, that's especially important if it happens like right immediately after a stroke. But even if the stroke has happened and some time has gone by, it still helps because it can help the surrounding cells recover better. It can help function of the surrounding cells that may be injured but is still functional. And it can help meaning the progress, meaning it'll help the brain adapt to the original injury. The first impression of Taika when he first came to me was that, this is a poor kid. This kid had a really bad situation, and it's unknown how well these people will do. Sometimes these kids can recover well, and sometimes they don't. So it's an anxiety-provoking situation simply because you just don't know what their future is going to be like. So the amazing thing about Taika is so far he's had about 13 sessions, and he's going to get at least a few more. I know we have him scheduled for at least 20 and more if he keeps improving. But the thing is, he's significantly improved. So he sees there's some improvement immediately with each session, which is probably just an activation of the cells in there that are not functioning as well temporarily. But then each time he comes back, he's significantly improved from the last time. So he's making lasting gains as well. So this is very encouraging, and hopefully we'll get him back to, it's literally within normal as possible, and this is the hope. For me, treating patients like this is incredibly rewarding. I'm a plastic surgeon, so I do get to treat patients and help them recover from various things, but typically not this kind of a thing. So it's really nice to be able to help patients who aren't within my normal scope of practice. It's really rewarding for me as a plastic surgeon, as a doctor, and as a human being to be able to offer whatever I can to make other people's lives better.